Today is Alzheimer's Advocacy Day here at the Capitol, and this particular event brings together entities and agencies and nonprofit organizations from all over the state with one goal in mind, and that is to give a voice for people with Alzheimer's disease and those who care for them.
Most of the lawmakers have been impacted by this disease, either directly or one of their constituents in their community, and we want them to know that there are people out here available to help them and support their family.
It's just extraordinarily important that we become aware of what's available, what we can do as legislators to keep this before the public, what we can do through public policy to assist the University of Mississippi Mind Center, all the hospital behavioral health units, the Department of Mental Health, which has a significant presence with these diseases. It's just a good thing to be together.
The organizations that are present here today are all part of the Dementia Care Network in Mississippi, and that includes the State Division of Alzheimer's Mississippi, the Mind Center at UMMC, and the Alzheimer's Association. And we partner together because together we're stronger in battling these diseases, and one of our main initiatives has been the development of a state plan in Mississippi to address Alzheimer's and other dementias, and that came into be 2 years ago, and we're now actively working on implementing action steps to achieve improvement in caring for people in the state.
There are over 52,000 Mississippians that are diagnosed with Alzheimer's disease or some form of dementia at this time. However, we think those numbers are probably higher.
I rarely meet somebody who has not been affected by Alzheimer's disease in some form or fashion. And there's a lot of questions, what do I do? How do I communicate with them? What are these behaviors? And am I going to get it? What does it look like? What should I be looking for? What are those signs and symptoms? And, so we try to share as much information to alleviate as much fear as we possibly can.
I'm Lee Corlew, and I have been an advocate and a volunteer since 1991. My passion comes from my family. Both my mother and grandmother had Alzheimer's, and my father-in-law had it too. I want legislators to know that they have a good history with Alzheimer's. There's been legislation passed in the past in their special care units, and there's a division of Alzheimer's within mental health, and there's the Mind Center, which is the research arm, and they have a wonderful clinic that helps people be diagnosed and know what to do. It was the missing piece of the puzzle.
We really encourage people to come and get evaluated and treated if they are having memory loss, because first of all, there are a lot of diseases that can cause the symptoms of Alzheimer's or other dementias that can be reversed. And also, if they are found to have Alzheimer's or another form of dementia, we want to be able to start treatment early on when it can have the greatest impact. And we also want to be able to support the families as the disease progresses.
The will is there, both nationally and within the state, to find those answers, because they know we're going to be overwhelmed. We absolutely have to find answers, and it takes research money to find those answers.
Somewhere along the way, every family's touched. I buried my father June the 20th of last year after an 8-year fight with Alzheimer's, and so my 5 brothers and I got extraordinary exposure. We read the books. We got familiar with the Mind Center and all the treatment programs. The good news is we're on the cutting edge in this state in treating and working through the Ole Miss Pharmacy School on pharmaceuticals to deal with Alzheimer's dementia. So it's a beautiful thing, and it's a story that needs to be told from one end of the state to the other.